Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive. And welcome to Smooth Health on the Drive, brought to you by Evercare Hospital, Lekki, right here on Smooth 98.1. Today we're talking about abdominal visceral pain, and our discussion will center around spine surgery options for managing chronic abdominal visceral pain. Now, joining us for the conversation, we have a professional from Evercare Hospital. We'll be speaking with Dr. Serge Razzkassoff. He's a neurosurgeon at Evercare Hospital. Now, Dr. Serge is double trained and double board certified, a neurosurgeon both in Europe and North America. He has extensive global practice experience in treating neurosurgical patients all around the world and skilled in modern surgical techniques in areas of complex spine surgery, stereotactic minimal access brain microneurosurgery, and neuromodulation pain management. Now, his special clinical and research interests is in headaches and facial pain, low back and leg pain management. Dr. Serge Razzkassoff is a fellow of American Association of Neurological Surgeons and also a member of the North American Spine Society. He's also an ad hoc reviewer for journal Neuromodulation Technology at the Neural Interface. He also has extensive neurosurgical experience with computer-assisted preoperative planning and intraoperative how's that word pronounced?
Navigational.
Okay, neuronavigational, based on image guidance. Now, Dr. Razzkassoff has medical licenses in the U.S. states of Ohio, Pennsylvania, North Dakota, New York, Michigan, Indiana, and Illinois. He's fluent in Russian and Ukrainian. So welcome, Dr. Serge. Thank you for coming on.
Thank you for having me.
And if you've got any questions or any comments for Dr. Serge, all you need to do is send them to us via WhatsApp. The number is 0809 444 0981. Or if you'd love to give us a ring, you can do that. The telephone number is 01 4489 981. So, Dr. Serge, can you explain what visceral pain is?
Yes, a hallmark of visceral pain is a diffuse and achy discomfort originating from internal organs in abdominal and pelvic cavity. The challenging situation with a visceral pain that it's difficult to control by any currently available means, which is includes opioid medication for nociceptive pain and adjuvant painkillers such as antidepressant and anti-epileptic medication for neuropathic pain. So this is briefly abdominal visceral pain.
Right. So what are the possible causes of this sort of pain?
Well, pathophysiology of chronic visceral pain is poorly understood. However, researchers and the pain practitioner think that visceral pain is caused by mechanical or chemical activation of visceral nociceptors from the wide range of underlying pathologies such as ischemia, luminal distension, inflammation, and malignancy.
Now, when it comes to abdominal pain, there are different possible sorts of pain. So how can a person be certain that these symptoms that they're showing are symptoms of this chronic visceral pain?
So usually chronic visceral pain typically lasts 5 to 6 hours a day, and it's triggered by eating or bowel movements. And the pain itself severe enough that could cause nausea or even vomiting. And it significantly interferes with daily activity of the person because of pain itself distracting patient from doing his usual work or leisure. And from side effects associated with pain medication, because we know that opioid medication could be very sedative.
Right.
And another usual symptom of the visceral pain is a rectal tenesmus, which is a very painful and distressful sensation of incomplete evacuation of the bowel, resulting in sensation of needing to defecate many times daily. This is another hallmark of visceral pain.
Okay, and Dr. Serge, can you share some examples of this sort of pain?
Yes, usually people who suffering from functional gastrointestinal disorders, inflammatory bowel disease with constipation, gastric paresis, interstitial cystitis, chronic inflammatory pelvic diseases in women, and also it's present in multiple oncological settings, including primary tumors of the rectum or anus, genitourinary malignancies with direct extension into rectum, or pelvic metastatic deposits from cancers like lungs or kidney.
So if a person has irritable bowel syndrome, that is a sort of abdominal visceral pain?
Yeah, so if he has a irritable bowel syndrome, some of the components, if his gastrointestinal disturbances associated with pain, it's very suspicious for that.
Okay, right. So when it comes to this condition, what are the risk factors? I mean, who's at risk of being diagnosed with this? Is it men? Is it women? Is there a certain age?
Well, usually it's more in women. The risk factor usually is actually food poison. So a lot of people after food poison develop those symptoms. Also, there is a growing evidence that significant overlap between chronic visceral pain and affective disorders, such as anxiety and depression. People who underwent any abdominal surgeries is a usual suspects for developing this pain. And people who's undergoing treatment with radiation of internal organs also very liable to develop visceral pain.
So there's a link between mental conditions or certain mental health conditions and...
Yes, correct. Because the pain is a phenomena which is sensing by brain. It could be originating from abdomen, but signals travel through the spinal cord and reach the brain, and this is where we feeling the pain. So if the patient have a brain disorder like a depression and anxiety, they make their brain more susceptibility for developing visceral pain.
Okay. Now earlier you said it lasts for up to 8 hours a day. Is this a continuous 8-hour stretch, or is it at several points during the day?
It could be either. It could be that sometimes it's a very severe attack lasting 6 to 8 hours, or could be just a few hours after a meal, and then it disappear. But during those hours, patients cannot do anything. He just lying in a bed or somewhere, cannot do any activity or work.
So if there was a pain scale of, let's say, 1 to 10, where would you put the sort of pain that a patient would feel?
It varies, but in majority of people it says above 6 up to 9, sometimes 10. It's a more kind of rare, but 6 to 8 is a pretty significant pain on a visual pain analog scale.
Right. We're speaking with Dr. Serge Razzkassoff. He is from Evercare Hospital, and we're talking about spine surgery options for management of chronic abdominal visceral pain. So if you have any questions, any comments at all for Dr. Serge, you can send them to us via WhatsApp 0809 444 0981, or you can just give us a call. The number to call is 01 4489 981. So Dr. Serge, can we talk about diagnosis?
Yes, diagnosis of abdominal visceral chronic pain is a clinical diagnosis. Basically, the patient would say that they have a diffuse non-localizing pain into the abdominal cavity or pelvic cavity, feelings like originating from internal organs, and like I said, hallmark would be that it's very resistant to the pain medications. So pain medication would give some relief, but not completely relief, and patients still will suffering despite taking pain medication. And another hallmark that these patients usually go through the full range of medical investigations. They would do different diets. They would do total parental nutrition without any improvement. They will go through the different colonoscopies or endoscopies, and all the results would be normal. Sometimes they will go through the general surgery, laparotomy. They opened their belly and didn't find anything. Right. And basically, hallmark is a lack of any pathological explanation of a painful condition, and this is would give a label of this painful condition as abdominal visceral pain.
Right. So coming back to the risk factors, said it's more common in women. When women have cramps during periods, is this classified as a sort of abdominal visceral pain?
It might, in case if it's a constant with every period, and it's a very painful, and the pain medication will not provide a pain relief. You might think about this too.
Okay, so let's move a bit from what we've spoken about to treatments and possible management as well. Can we talk about this, the surgery options, the spine surgery options?
Yeah, the spine surgery option for treating abdominal visceral pain has a strong anatomical and functional basis for its role in treatment of this kind of pain. The procedure of spine surgery for treatment of visceral pain derives from our advances in understanding of pain pathway in a spinal cord, and the evidence that the spinal cord pathway is a plays dominant role in conveying visceral pain signals to the brain. So the spinal surgery is a disruption of this pathway in a spinal cord with a minimal side effects and complete and immediate relief of the pain after procedure.
Immediate?
Yes, this is why it's so effective. Also, it's important to understand that in majority patients who undergo this surgery, they don't need any more pain medication, or in case if they need a pain medication, the dosage is significantly reduced. Also, there is a considerable evidence in the medical literature for good efficacy and safety of this treatment, both for cancerous and non-cancerous severe abdominal visceral pain.
Right. Well, we're speaking with Dr. Serge Razzkassoff, and we'll take a quick break. But when we return, we've got a lot more to ask Dr. Serge. And if you have any questions or comments, Dr. Serge will be happy to take your questions. Remember, you can send them to us via WhatsApp 0809 444 0981. This is Smooth Health on the Drive, brought to you by Evercare Hospital.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria. Love music.
Love music.
Love music. Love music.
Love music. Love music. Music. Music.
Love life.
Love life.
Love life.
Love Smooth 98.1.
'Cause I feel so high, I'm reaching out for your sky. I feel so high when I'm touching your sky, baby. I feel so
Listening to Smooth Health on the Drive, brought to you by Evercare Hospital Lekki, right here on Smooth 98.1. We're talking about spine surgery options for management of chronic abdominal visceral pain. The expert is here, and he's Dr. Serge Razzkassoff. He is a double-trained and double-board certified neurosurgeon, both in Europe and North America. Welcome back, Dr. Serge.
Thank you.
Right. So, talking about treatment options, can we speak about the spine surgery options?
Yes, I wanted to explain that this is considered as quite a short surgery, so usually lasts 2 hours. It's done although under general anesthesia, required intubation of patient and going completely asleep. Patient is positioned prone on a special table, and we're using a fluoroscopic X-ray machine to localize the opening in the spine. Usually, location for the surgery located in thoracic area. Surgery involves cutting the soft tissue and removing paraspinal muscles from the vertebra, removal part of the bone in a vertebra, and opening coverings of the spinal cord. Then, under optical magnification with a microscope or surgical loops, we localize in the midline of the spinal cord on the posterior surface, and using a tiny needle and basically making a small lesion right in the middle of the spinal cord in a several distance where there is an opening. By doing this, we just dissecting and interrupting the pathways which specifically provide convey signal of pain from visceral organs from the abdominal cavities through the spinal cord into the brain. So by doing this maneuver, we selectively lesioning those pathways and no effect on other function of the spinal cord. After and its procedure is done under the electrophysiological monitoring, which includes putting the needles in patient's arms and legs, in muscles, and the person who is doing monitoring, he constantly checking and probing function of the spinal cord, that when I'm doing procedure, I know that I'm not affecting important parts of the spinal cord. So this makes procedures very safe. After the lesion is achieved and there is no any untoward events, we need to close the dura very tight to prevent the fluid to escape from the wound, because spinal cord is located in a fluid which is helping spinal cord to prevent bumping into the bone. Then we close in the wound, and patient then turned on her back, and anesthesia will take the tube out of the throat and wake up the patient. And then patient will spend a day in intensive care unit. We make sure that he's completely, walk and using his arms and legs and eating and drinking and breathing, everything good. And then patient go home. We'll check the wound in 1 week and in 1 month. And basically, this is would be enough for the management of his pain.
Right. So when people hear about surgeries around the spine, there's always a fear or concern about that.
That's correct. This is because there is I would say, misunderstanding historically in 20th century when the spinal surgery was developed, and there was a concerns that spine surgery would be a dramatic treatment, because at that time there is no medical technology which now available. So basically now we have high-speed drills in a OR. We have to take carefully the bone out. We have operating microscope. We have specially designed a spine surgery table, which is basically allows us to do X-ray in any position. But majority of advances came from anesthesia that we can treat even older patients, which previously considered non-surgical candidate, and also after surgery care in intensive care units. So now there is such advances in different medications and different ways of monitoring patients after surgery that basically the surgery itself is not a challenge anymore. And in developed countries, the spinal surgery is done by thousands and thousands patients every year, and the side effects from the surgery usually less than 2-3%. So this considered as a very safe surgery. It's very safe, and also compared to other spine surgery, which involves placing screws and rods in spine, this procedure doesn't require placement any hardware in a patient body. So this makes it much easier.
All right. And so talking about the recovery after a patient goes home, is there an amount of time they perhaps need to stay in bed to recover, or can they go back to daily life within a few days?
Basically, there is no... we will check, of course, before discharging patient that there is no numbness or any difficulty with movement control. I prefer usually patients to go back to normal life. There is actually... the early patients ambulate and start walking, it's better rather than laying in a bed. Yes, after surgery, they will have a pain from incision where the surgery is done, and this would be provided by different pain medication just to treat incision pain, which usually last a week, and then in a week time we will take the sutures out, and basically that's it.
Okay, so I'm curious about this. Are there perhaps other treatment or management options of this chronic visceral pain, abdominal visceral pain, that are perhaps non-invasive or considered traditional?
Well, I would not say that it's a non-invasive because, the traditional way to treat in pain is a pharmacotherapy using pain medication. But like I said and explained that this particular pain is very resistant to the medication, and this is why there is other options. Other options including different nerve blocks. So this is also interventional pain management, and it's could be done in the hospital. Again, for this, patient doesn't need to be going through the general anesthesia. It's awake procedure. So it's done still using the X-ray fluoroscopy, because in order to do nerve blocks which innervates internal organs, you need to put a big needle around the spine, because all the nerves going to the internal organs are originated from the spine, from the spinal cord. And in order to know where to place injection and the medication, which will block signal from internal organs, you still need to use an X-ray to see where is the location of the needle. However, this could be done on an outpatient basis. Patient will come to the hospital and done procedure in a fluoroscopic suit, and then could be discharged same day. There is no need to be staying overnight. The only drawback that its effect could last from 1 month to 3 months, and then pain will recur, because this is a pain management option, not a cure. The cure comes with surgery.
Right. And these treatment options that you've talked about, from the surgery to the management, are these all available at Evercare?
Yeah, that's correct. So both spinal surgery option and interventional pain option with fluoroscopic guidance is available. So management of Evercare Hospital invested in equipment in OR. So we have all state-of-the-art equipment for the spinal surgery, and also very good fluoroscopic cath lab machine, which makes very easy to do those nerve blocks. And like I said, also it's very good that there is a very good intensive care unit for postoperative management of the patient who undergoes this type of surgery. So I think it's one of the best in the country.
All right, we've got a message coming through on WhatsApp. This says, "Hello, doctor. Is there any correlation between the abdominal visceral pain and fibromyalgia?"
Yes, the people who are suffering from fibromyalgia is also have this condition where there is a link between anxiety and depression. So they also very sustainable for the developing visceral pain disorders.
Right, and she asks further, can the surgery work for this condition?
Well, in general, yes, it could work. However, like I said, all the patients need to go through the evaluation and make sure that there is no other explanation why patient have this type of pain. If all the evaluations and investigation is negative, and patient understand what is it involved to go through the spine surgery, this could be a good candidate.
Right. So I want to come back to this again. Can you once again share some examples of visceral pain of the abdomen?
Yeah, I would. Let's give you an example. So usually it's a middle-aged woman who would come and say that I have a lot of pain in my abdomen, usually when I start eating something, and then it's associated with a painful defecation act. And despite that, all investigation that, like I said, they would go through the colonoscopies, different diets, different pain medication, nothing helped. And when she would go to a gastroenterologist, let's say, they would say, well, you have irritable bowel syndrome. We check all your intestines and look in your pictures inside of your gut. There is no abnormalities. There is no tumor. And patient would still have a pain. And for her, it would be, major stressful situation because, she can't live her life normally. And those patients is looking actually for the complete pain relief. And initially this type of surgery was initially done in patients with different abdominal cancers. So, but then other patients who don't have a cancers found that their relatives had this type of surgery, and then said, can you do this for non-cancer patient? And like I said, literature shows that doing this surgery have a very good effect even for them.
Right, and so thank you so much, Dr. Serge, for coming through. Have you got any last words or any advice for our listeners?
Yes, I would say that they need to understand that there is options for to relieve their suffering, and that spinal surgery treatment options for abdominal visceral chronic pain provide dramatic and sustainable pain relief with minimal side effects and long-term basis.
All right, and can you let us know how the listeners can contact you at Evercare Hospital?
So I'm having clinics in Evercare Hospital every Tuesday, and they can call phone 0813985070 and book an appointment. Also, they could go on a website www.evercare.ng or send email at info@evercare.ng. The hospital is located on Admiralty Way 1, and it's Busola Durosini 80 Drive, Leki Peninsula Scheme 1, Leki, Lagos.
All right. Well, thank you very much, Dr. Serge Razzkassoff, neurosurgeon from Evercare Hospital, Leki. And that's it for Smooth Health on the Drive right here on Smooth 98.1.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every
of cancer.
Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.